Well, hello and welcome to today's RMIT talk. I'm Professor Regina Cramey, the Associate Dean of the Allied Health Cluster here at RMIT University. Before we start today's session, I'd like to acknowledge the people of the Woiwurrung and Boonwurrung language groups of the Eastern Kulin Nation on whose unceded lands we conduct the business of the university. RMIT respectfully acknowledges their ancestors, elders, past, present and emerging. And while we conduct our work remotely, I want to pay my respect to the wider lands of these the unceded lands of this nation. All right. So if you've ever had a sore neck, an upset stomach or a dodgy knee before, you've probably come across the term allied health. Healthcare is currently Australia's largest employing industry. Australia's 195,000 allied health professionals represent more than a quarter of the healthcare workforce. The allied health workforce continues to grow, and as demand grows across the aged care, mental health, disability and health sectors. But what is allied health? Why is it important? And actually, what do allied health professionals do? To answer all these questions and more on this wonderful Sunday morning, our team of RMIT academics will explore the disciplines of osteopathy, chiropractic and Chinese medicine, discussing what role each of these can play in the overall health and well-being of the population. Just before we get started, I want to reiterate that we have 15 to 20 minutes at the end of our panel session to answer questions from the audience. You can submit these questions in the Q&A tool on the right at any time, and we'll do our best to answer as many of these as possible. If we run out of time, please remember our live chat is open and can be joined at any time. Now, obviously you can see our wonderful panelists here today, but let me get them to introduce themselves. Firstly, Dr. Sandra Gayson.
Thanks, Regina. I'm Sandra, and I'm the discipline leader of chiropractic at RMIT. I actually graduated from RMIT in the mid-1990s, and I came to want to study chiropractic after jumping off a couch one day and wasn't able to move. And after getting relief from a chiropractor, I thought, oh, that is incredible, and I want to be able to do that too. And so the following year, I started the program at RMIT. And here I am 30 years later. So I still practice as a chiropractor, and I have done for the last 25 years, and feel privileged to be able to support people that are experiencing pain or dysfunction. I commenced working at RMIT in the early 2000s and have loved being involved in the process of teaching and mentoring students, and that's it really. Thanks, Regina.
Beautiful way to commence there, Sandra. Thank you so much. Associate Professor Tony Zhong. Tony.
Hi, Regina. My name is Tony Zhong. I'm the discipline leader for Chinese medicine at RMIT University here. I have been at RMIT for 17 years, and I had the fortune to lead the Chinese medicine department for the last 10 years. Starting my career as a Chinese medicine practitioner, I subsequently received postgraduate training in public health and clinical epidemiology. After getting my PhD from RMIT University, I became an academic and clinical researcher at RMIT. I teach a lot of courses in Chinese medicine, Australian healthcare system, evidence-based practice, and so on. I look forward to chat with our prospective students.
Thanks, Tony. And last but not least, Dr. Azrin Fazelboy. Azrin, thank you.
Thanks, Regina, and welcome everyone. Good to see everyone around. I'm the discipline leader for osteopathy at RMIT. I've been at RMIT for the past 6 years, and I have had the pleasure of being the head of discipline for the past 5 years. I am an osteopath by training, and I have a PhD in neurophysiology of pain. I have come to this position after some experience in industry as an osteopath, and I continue to work in osteopath, and I'm looking forward to having a conversation with everyone about the training program at RMIT.
Perfect. So it sounds like we've got the right people on the panel today. Sandra, I'm going to get you to kick us off. I think one of the things, particularly as parents and students in the forum today will really want to know, what does the term allied health mean, and how is it different to other allied health services?
I think the term allied health includes a whole group of health professionals that aren't medical, dental or nursing professions, Regina. So it would include professions like Chinese medicine, chiropractic, osteopathy, as presented here today, but also exercise science, psychology, medical radiations, myotherapy, and many more. All the disciplines that I've mentioned today can be studied here at RMIT as well. Each allied health professional too has their own area of expertise, and therefore often there would be a team approach to the care of patients so that all the needs of the patients are met. That way the patient can gain the best outcomes for their health. The difference between the healthcare services of an allied health professional and that of other may be that allied health professionals could be identified as those that perhaps have been university qualified, that are evidence-based practitioners, and come from disciplines that have been accredited by national accreditation bodies or other industry bodies. I think that would describe it.
Perfect. Okay, team, let's get down to the nitty-gritty now. What I'd really like to do, and I think what our audience would really like to know, is what is the specifics of your area and how it helps people. So Azrin, let's start to talk with you. Let's talk about osteopathy and what it actually means and what the discipline actually entails.
Yeah, that's a really good question, Regina. So osteopaths are trained to assist with pain and function-related disorders or movement-related disorders, particularly of the musculoskeletal system. Now, the musculoskeletal system comprises of muscles, bones, and joints and ligaments. We know that it is common for people to experience back pain or neck pain or shoulder or knee issues. And as osteopaths, we are trained to undertake thorough assessment of these areas and to provide treatment or management strategies. We also know from scientific research that a proportion of people may also experience ongoing pain or chronic pain. And that research also informs us that alterations to your lifestyle are important for the management of these conditions. So the osteopathy program at RMIT trains you to deal with this appropriately.
Perfect. Thanks, Azrin. Tony, Chinese medicine, let's unpack that a little more.
Thanks, Regina. Chinese medicine practitioners use various forms of intervention, such as acupuncture and herbal natural products to help people to address the health problem. The acupuncture technique, it involves the use of a very fine needle, the insertion of the needle through the skin. Scientific research has shown that a range of benefits can be used receiving acupuncture treatment. For example, acupuncture can be very helpful for pain relief. There's other symptoms also be able to help out as well. For example, nausea, vomiting, migraines, and headaches. So in modern day, herbal medicine can be used in many different forms, including powder form, tablet form, or capsule form. There's many other techniques we use to help people to prevent their health issues or maintain the health well-being. For example, the Tai Chi exercise, for example, losing cupping and dietary therapies. That is the range of intervention we use in Chinese medicine practice.
Beautiful. Thanks, Tony. And I think it's really important that all of the things that we do are really evidence-based. So thanks for that. Sandra, let's chat about chiropractic.
Wow. Chiropractors support patients to prevent the onset of musculoskeletal conditions. And I know that Az has already said that that's what osteos also do. So I think we're fairly similar. So that is we, look at conditions of muscles, ligaments, joints, and nerves in the body. And then they also diagnose these conditions in patients that have issues and set up management plans and treat these conditions. So if you have neck pain, back pain, neck-related headaches or injuries from work or sport, chiropractors would be ideal practitioners to see. Chiropractors would work holistically as well to ensure that your goals are met or the patient's goals are met, and therefore may include hands-on therapies like manipulation or mobilization of joints. They also may utilize muscle therapies like massage, and would also sort of provide rehabilitation plans to patients. But also, a chiropractor would also want to assess the patient's lifestyle factors that may be contributing to their experience of pain or dysfunction. So they might look at the stress that you have in your life, or the level of movement or exercise you have, perhaps even your ergonomics at work or at home at the moment, and also your diet. So hopefully, given all this information today, you have a little bit more of an idea of what chiropractors can do.
I'm sure I'm like almost every one of our audience today going tick, 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 tick. That is me. So absolutely. Yeah. Thanks so much for that. Now, a quick reminder to our audience that we have a live Q&A tool that is open. So please submit your questions to the chat function on the right. Our panelists obviously here, they're fabulous. They're here and they'll try and answer them at the end of the discussion. Now, my favourite question at the moment. So what's the most rewarding part of your profession? I think as students or parents who are looking for their child to come into this profession, what's the rewarding component of being in it? And, for you each personally, what's been the most significant or formative moment in your career that you've either experienced as a practitioner or with a patient? Sandra, I'm going to come back to you to start with.
Oh, really?
I am, yeah.
Oh, okay then.
Go.
Look, I just want to say that I know that everybody sees what they get out of their discipline differently. But for me, I think the most rewarding part of being a chiropractor is knowing that every day I go to work, I'm making a difference to the health and well-being of my patients' lives, and that makes me feel extremely privileged. And I always leave work feeling totally energized. My husband would say to me, Sandra, don't talk for 15 minutes when you come home, because I have so much energy by the connections I have in my workplace. So yeah, it's really great. Over the years, Regina, there's been so many formative memories. The most formative, but probably the most embarrassing, was in a consultation I had when I was a student with a patient. And the patient said to me, if you stop talking and start listening, I'll be able to tell you what's going on. I have never been more embarrassed in my life, but I learnt on the job that day that it's all about the patient. Patient-centered care is really, really important. And whilst it was difficult to face that day, it stuck with me forever and made a huge difference.
That's fantastic. Sandra, I think what's really important, and I know we've had discussions this week with students, is how much that communication is a vital component of being an allied health practitioner. And it's as important, if not more so, than the hands-on therapy that you provide. So for those students out there who are looking at this, don't forget that it's not just about applying hands or doing the therapy. It's also about understanding and that communication strategy. And you can learn it live, can't you, Sandra?
Oh, absolutely. Absolutely. And, as an allied health practitioner where we form multidisciplinary teams, the most vital part of that is being able to communicate. And if our patients can't actually connect with us and we can't communicate with them, we're probably not going to see them again.
Yeah, absolutely. Yeah. Thanks for that, Sandra. Beautiful. Tony, let's go. What's been your formative moment?
I think as a teacher, the most rewarding thing, of course, to see our students complete a program and establish their health practice. When they send an email to you or send a Christmas greeting card to you at the end of the year, say, hey, my clinic's open up and I'm helping a lot of patients. So that is the best rewarding thing for us. In terms of as practitioners, I have a very special moment a few years ago when I supervised a student in clinical placement for acupuncture. A patient arrived by taxi because of the sudden onset of severe pain on the low back pain. He had got that for quite a long time. And after the treatment, the patient was able to walk slowly. So when we walked the patient out from the clinic, the student was so proud and just talking to everybody, say, look, I help him. I am so proud of this. So when I look at those things, I said, actually, we are very proud of our students, what they can do as well.
Beautiful. Thanks, Tony. And we are here really as teachers, aren't we? And that's part of our reward for that. Azrin, let's go to you.
Yeah, thanks. So, I mean, I'd like to definitely second what Tony has said. I mean, it's a really, I guess, a privilege to be able to play a part and assist students in their training and then watch them turn into colleagues of ours. It's very, very special. But I can definitely say that as a practicing osteopath, it is really, really a good opportunity for us to be able to act as, information givers. With the age of the internet, the amount of information out there, and unfortunately the amount of misinformation about musculoskeletal health, how to manage your back pain, how to exercise, what sort of diet you should be following. There's so much information out there. And I guess as a health practitioner, for us to be able to help patients untangle that information and be able to help them, assist them to be able to get better, I think that's probably one of the most rewarding things. I also have very special moments, mentoring a few colleagues. And I do remember one incident where it was a Saturday afternoon and a car mechanic had walked in through the door being dragged in by a colleague of his because he had an acute episode of back pain. And he was literally limping and had to be assisted in. Being able to just provide those principles of reassurance, telling him that nothing is significantly wrong, the likelihood that his brain has just sensitized the area so it stops him from moving too much. It was just powerful enough to be able to get him out of there feeling well informed and providing a bit of a pathway as to what the next few days look like whilst his body got over the pain. These are some really, really rewarding things.
Lovely. And I think the other thing that you team, because you're just so understated in what you do, is everything that you do is all about the research and understanding what the best evidence-based practice is, informs our practice, informs our teaching, and really it's about what is up to date, not what the internet is telling you, but what's up to date now and how do we inform best practice about that. So I'm going to state that for you because I know you don't sell yourselves as much as you should. Okay. Now, I had the privilege of doing a bit of history about RMIT just recently, and one of the quotes really stood out to me, and that is a skilled hand and a cultivated mind. And that was the RMIT motto back in 1887. And I think our disciplines really, that's what continues to inform our best practice, always with that in mind. So I didn't know that when I joined RMIT, but I really love it. So again, Sandra, I'm going to put you on the spot because I like to do that today. Let's talk about for our potential students and our parents who are really nervous about what that VTAC guide submission looks like. How do we prepare our students for future careers?
Well, I think a lot of the preparation for students needs to come in their placements at the end of the day, Regina. So in the last 2 years of the chiropractic program, students have the most incredible placement opportunities to gain that hands-on experience required. Each of these opportunities, students are supervised by registered practitioners that are out there practicing at the moment, so they can give them great feedback. Each of these placements would give students experience in assessing or diagnosing or treating a broad range of patients and presentations, and this helps to prepare them for work after they graduate. At RMIT, this means that students can graduate work ready and at the same time being connected with life and the community around them. So some of the opportunities our chiropractic students have for clinical placements include an Indigenous placement in partnership with a community organisation called Hands on Health Australia. This placement is with the Fitzroy Stars football team. So students who love sport and love being connected with other communities, like an Indigenous community, have this opportunity. So they engage in managing and preventing injuries of the footy players, but also helping out with the health of members of the local Indigenous community there. Another hands-on clinical placement we have is at the Wellington, a community centre in the heart of Collingwood. This centre is a drop-in centre which provides activities and social support for those that perhaps are isolated or disadvantaged in that local Collingwood area. And students have the privilege to provide chiropractic treatment to the clients of the centre there for their aches and pains. And these clients would generally not have access to this form of care in any other environment. We also have global life-changing experiences where final year students get to undertake one of their placements overseas. So over the last number of years, they've had a few choices of these placements in India, Samoa, and Japan, and I've had the opportunity to supervise a number of these placements in India. Even for me, they're life-changing, and I've observed these placements with the students, and they're definitely life-changing for them also. About 20 students a year get this opportunity to go overseas, and I think all these placements, Regina, really contribute to students becoming more resilient and compassionate, and then getting them ready for life and work. So we're pretty proud of them, really.
It's really interesting, isn't it? Because, I mean, I'm here because of the RMIT ethos that we produce work-ready graduates. And, as a parent, that's what I want. If my child is going to come through a university program, I want them to be able to get a job at the end of it. And I think with all of our work integration models that we have, whether it be in aged care like the Assisi Aged Care, whether it be elite sports teams like the AFL, with our Indigenous population, with our disadvantaged populations, we give students really that perfect opportunity to really decide where they want to play, whether it be in osteopathy, Chinese med, chiropractic, or in fact exercise science, which is one of my other disciplines. So, we really do allow the student to develop and evolve. So that's fantastic. All right, so team, looks like we are inundated with questions. So I'm now going to put you all on the spot. So here we go. Let's have a look. Oh dear. So the one question it's the first question that I asked when I first came into RMIT, and I'm going to go to Azrin first for this one. What is the difference between chiropractic and osteopathy, and how can I choose which course to do? Azrin.
Yes, that's a very, very good question, and a very common question that we seem to get. So I think that the first thing to probably highlight to make things a bit more challenging is that really, if you look at the way evidence-informed practice is taking us, the reality is that osteos and chiros, we both fit under the umbrella of musculoskeletal health, and therefore, if we look at, again, going back to evidence-informed practice, we're probably converging more than we are diverging, but it's unlikely that we're going to become one profession. I guess it's not an easy choice as to which one you choose. The reality of the situation with all of these types of allied health services is that different things work for different people. And both as experienced practitioners, Sandra and I can tell you that we've seen patients who may have sought other allied healthcare services, and then they're able to come to us and get the assistance that they need, or vice versa. And so what I would really highly recommend for parents as well as potential students to do is maybe consider thinking about going and seeing one of these professions, looking at what their training looks like, looking at what their services look like. And that way you can make a little bit more about an informed decision about which profession would suit you better.
Absolutely. Thanks for that. Sandra, did you have anything else to add to that?
No, I think that was really well put. Yeah.
And we obviously have our health sciences clinic at Bundoora, where our students, before they graduate, go and spend a substantial amount of time doing their work integrated learning. So there's an opportunity there if you're a family in the area and like to come out to Bundoora. Our health sciences clinic is there for patients who have needs to come in, and they get treated by our 4th and 5th year students, and it's fantastic both for osteopathy, Chinese med, chiropractic, and in course psychology as well as there. So thanks for that. We're going to continue with that discussion a little bit, and I think it comes back to what we do as multidisciplinary teams in the allied health profession. So Sandra, do chiropractors and osteopaths work with physios? I think it's a really important question that we answer today.
Oh, do we work with physios?
Yeah.
Yeah, we definitely work with physios. We need to be able to work as teams, Regina, to be able to meet the needs of our patients. And there's times where a patient will present to me with an injury that I just don't have the expertise to manage. And so I will refer them to a physio to be able to manage that presentation, and we'll work as a team to be able to do that. So a little bit like we work synergistically and holistically to be able to meet the needs of our patients.
Yeah, and I know within our particularly, well, even from 3rd year onwards, we spend quite a lot of time talking about language and communication strategies, and it's not just about communicating with patients, it's really about communicating amongst these multidisciplinary teams, as which it's going to get more and more as we go through, and particularly with what we're going through and experiencing at the moment. So thanks for that. Tony, not forgotten down there in the corner. So let's go. So one of our prospective students has read that RMIT is the only World Health Organization collaborating centre for Chinese medicine in Australia. What are the advantages for any students out there, Tony?
Thanks, Regina. I think the correct title is World Health Organization Collaborating Center for Traditional Medicine. So indeed, this is the only one in Australia. It's only very few of them in English-speaking country. So we are very pleased institution having such a collaborating center. We had that for the last 15 years or so. The biggest advantage of this one is we are able to connect with, particular from the Western Pacific region, for the institution providing the training in traditional medicine. We are able to participate and contribute to those benchmarking guidelines, regulation settings for in the field. So at RMIT here, we had hosted a number of meetings for the collaborating centers, regional directors, and other health authorities and professional in Chinese medicine, chiropractics, and all these sort of things able to help us to prepare our students well, aligned with the global trend.
Perfect. Thanks, Tony. I think as a student coming in, and I know, as I said, one of my own children is doing year 12 and they're looking at their future. Azrin, one of our potential students, wants to know how intense the workloads are for the courses. And I think it's an important question. So do you want to give us a feel for, you know, what the load requirements are for students as they're thinking about coming into one of our disciplines?
Yes, indeed. So, I mean, we do, our programs are all a 5-year double degree. It is a Bachelor of Health Science and Bachelor of Applied Science in osteopathy in our case. And I guess, you know, the workload does require you to be a full-time student. And I guess it does vary from year to year. The program is structured in such a way that we provide, you know, our foundational basic science skills to begin with. We then move on to more foundational clinical skills, and then we're really moving off into integration. So each semester you take on 4 subjects or 4 courses, as they're known at RMIT, and the standard working load would be somewhere close to 20 to 25 hours per student. That's guided by the teachers.
Okay, perfect. So I think one of the other things, and we've spoken about a lot, but I think we want to unpack this a little bit more about the work integrated learning. We use that term WIL almost every day when we're at work, but I think some of our prospective students and our parents don't understand what that term actually means. So let's unpack that a little bit more. Tony, let's go back to you a little bit, because I think what the Chinese Medicine Clinic has is fantastic, and let's talk about the experiences that our students can have during their course or their program.
Yes, so I think as Regina previously mentioned, like we had a fantastic health clinic at RMIT. So this clinic is purposely built about 5 years ago. It's a multidisciplinary clinic in BC Shopping Center, just opposite RMIT Bandura campus. So we have 65 treatment rooms. We also got digital X-ray facilities on site. And herbal medicine processing and dispensing facilities. And of course, we also had a psychology there as well. I would say with the 65 rooms, state of the art and purposely building like that, perhaps it's the best facility you were able to see in Australia that has chiropractic, osteopath and Chinese medicine all in the one roof.
Yeah.
I'll say too, remember, it actually has psychology there as well, Tony.
Yeah.
Exactly.
I remember the first day that I worked there and I went home and I said, wow, that is the most amazing workplace to work in. And I just thought, oh, I can't believe that I've got this opportunity. Yeah, it's absolutely beautiful.
They are beautiful. I think the beautiful thing is, so I know some of our potential students are saying, so what is my career path? And obviously we are setting yourself up to work in your own clinic or in clinics within the community in private practice. But that's not the only place that we're setting students up for. Azrin, can I come back to you? I'm going to ask you to unpack a little bit about our Eagle Hawk Clinic in Bendigo. Is it Bendigo? And just tell us a little bit more about the other experiences that students have and what work integrated learning means. It's not doing additional bit, it's part of your course preparation.
Correct. Yeah. So, I mean, we're always looking for opportunities within our teaching, from our, early years, year 1, year 2 of the program, where we're trying to foster an environment that replicates what real life practice looks like. Now, we know that, different settings appeal to different people. Some people some osteopaths enjoy the opportunity to work on sports injuries with elite sporting athletes. Some others prefer to work regionally or remotely with community-based practices. And so in order to be able to replicate that, we have an opportunity for students to go to Bendigo in Eagle Hawk. That is a regional placement. And we're providing osteopathic services and osteopathic care to some underprivileged communities that wouldn't have access to that service if it wasn't for our students being able to provide it. So throughout our program, we are always providing opportunities for students to experience different things. And that way, number one, it allows them to be able to start to think about what their own practice looks like when they become a professional. And secondly, should they choose further down the track that that environment no longer suits them, then they have enough transferable skills to think about moving into another space. And thereby it really creates a level of longevity into their careers. So you're spending 5 years doing a double degree, you want to at least get 10 years in the profession, even up to their age of retirement, hopefully. So our Eagle Hawk placement is an example of that. We have a placement where we have students going to a corporate sector as well, providing some care there. We have the women's AFL football team where we've got students going there. So there are a number of examples where we have these placements.
Yeah, beautiful. And Sandra, in chiropractic, you have a very similar number of placements that students can take to fulfill the course requirements for chiropractic. Is that correct?
Yeah, very similar. And, we work alongside osteo in the AFLW at RMIT. And that's been found to be an incredible program for the students that take on that opportunity. Yeah.
Beautiful. I think we need to unpack a little bit about the dual degree. So students who are coming in for all of the disciplines here, it's a double bachelor, Bachelor of Applied Science, and then a Bachelor of their discipline. Tony, can you unpack that a little bit for any student? And this will be the same for the other disciplines, but I'll get you to correct me if I'm wrong. Do you want to just talk about the double degree and how that works?
Yes. So the three programs at RMIT, Chiropractic, Osteopathy, and Chinese Medicine, they're all double bachelor degree. In the first 2.5 years or so, we study very similar course in physiology, anatomy, pathologies, and biology of cells, and so on. So you will be able to study with a big cohort together to understand the chiropractic, osteopathy, and Chinese medicine. So after the first 2.5 years, they will go into a more specific study in the three disciplines we just mentioned about. Of course, you will undertake the real placement we just talked about, and the clinical placement, and then graduate with become a registered practitioners. Very common though, we see our students after graduate, because after graduation they got a double bachelor degree. They enter into other profession. For example, they further to study research, become researchers because they have been trained in biomedical sciences, or they continue on after some years later and they want to study medicine, they also study other profession. They're all totally fine because they have been trained with all those skills.
Yeah, absolutely. And obviously public health at the moment with the pandemic that we've got going on at the moment is also another area. Once you've got a basic training in a applied science, you have the potential, if you want to see what that horizon looks like. And we obviously train you for that individual discipline profession, but that doesn't necessarily mean for the entirety of your career that you need to be that profession, because we give you a holistic training. Does anyone else have anything to add for that before I head back into other questions that are coming through? Go, Sandra.
As I said before, sometimes I need to stop talking.
No, not at all. Go for it.
I did pick up that Tony said that after 2.5 years, we start to get more into our disciplines, but we do actually start discipline-specific hands-on practice from first year. So you do really get into your discipline quite early, which is really good because you get to kind of feel part of the profession from the beginning, really. And I think that's really important.
Absolutely.
Yeah, exactly.
We have students wanting to know which campus our courses are taught on. Azrin, do you want to just take us through where they are for us?
Yes, so the entire program can be undertaken at the Bundoora campus, in particular the Bundoora West campus. So all your classes will be scheduled on that campus. All of our programs do have an elective, a course that you can do of your own interest, which can be undertaken at the city campus if you want to. You can choose to learn Spanish. You can go learn to do some engineering. You could do whatever you want with that one particular elective. But I would say that a significant most of the course program is offered at the Bundoora West campus.
Beautiful. Thanks for that. Yep, Sandra.
We've actually also got a very quite new accommodation on the Bundoora West campus too, don't we? For students that need on-campus accommodation. Yeah.
Mm-hmm.
Yeah. So I think one of the other things, obviously we're seeing, and I'm going to come back to you, Sandra, because one of the beautiful things about studying at RMIT is we have practitioners who are still practicing, still applying their craft, actually teaching. And Sandra is one perfect example of that. She's the discipline leader of chiropractic, but she owns her own business, so she still sees patients. What are you seeing with the COVID-19 pandemic? Is there lots of difficult cases? Is there a lot more cases coming through of patients with special needs out of what they're sitting down doing day to day?
Well, an interesting question, Regina, because as of late last week, I probably won't be seeing too many patients for the next 6 weeks, but up until that time in Victoria, we were seeing an awful lot of patients that have been stuck to their chairs at home over the last however many weeks working from home, and the ergonomics of their working environment has not been great. So they're presenting a lot with neck and back pain. So we've been working with them trying to engage them in more activity, having a look at their workstations, recognising that, look, this period is really stressful on our bodies, and that's a whole multifaceted approach to actually dealing with this, whether it be getting out for a walk, trying a new activity in life to, you know, decrease our mental health issues. Yeah, there's a lot of patients that are really struggling at the moment due to the fact that we're just not getting out.
Absolutely. One of the other questions that's coming through, and I'm going to come to Azrin on this one, is about how many days do they need to be on campus? And let's unpack a little bit about our remote learning and how RMIT, like every other academic organisation at the moment, your institution has gravitated and by necessity towards this, you know, off-campus learning. And then I want to unpack a little bit with you, Azrin, as well, about all the practices that we've put in telehealth and how we're setting our students up for success in what the new working environment might be. So can I come to you for that, Az?
Yeah, sure. So yeah, I mean, look, we do have flexible options. You know, you're not required to be there all day, every day. If you prefer, and that's your, you find that your own personal learning style is accustomed to that, then that is obviously on offer to you. However, we do have opportunities for students to be able to learn remotely and then be there face to face to do some of the practical components. As Regina has mentioned, we are also looking at opportunities and have moved forward on a number of opportunities to provide training for our students with telehealth. We know that this is something that is going to be our new normal. It's not going away in a rush. And giving our students opportunities and experiences to be able to be trained in that also is really, really helpful for their future practice. It also opens up the opportunity to be able to provide services regionally and remotely. I mean, there are 3,500 osteopaths across Australia, 1,000 of them are here in Victoria that are very successful. But, you know, say Northern Territory has 5 osteopaths or 2 osteopaths, you know, and so being able to skill up our future colleagues, I should say, with these skills is extremely important, and our program does facilitate that.
Yeah, it's interesting because I met with your final year graduates this week, and it was all about, we are educating you in something that's going to make you highly employable once you graduate. Tony, for Chinese medicine, the same, I know you're utilising telehealth. What are the options for graduates as they're graduating from Chinese medicine?
Yes, it's very similar to what I just mentioned. Like Chinese medicine in Australia, we are very fortunate, in particular in Victoria here, because starting from the year 2000, the Chinese medicine has been regulated in Victoria, and then later on in 2012, become a nationally regulated profession. So altogether, we had about 5,000 Chinese medicine practitioners in Australia, about 30% of them in Victoria. Many of them like in the CBD or a particular area. So we noticed that from the past year, students, if they go a little bit remote from a few hundred kilometers away from the CBD, or even just 100 kilometers away from CBD, there's a lot of job opportunities out there. So that's we observed it for the students' future.
Beautiful, thanks, Tony. Anything else from you, Sandra, with regarding that?
No, look, it's similar. The job prospects are broader than they ever were before, whether that be in a private practice or a multidisciplinary practice or in aged care. We've got students in aged care facility in Melbourne doing a placement there. I've known people that have worked at the TAC or regulatory bodies like APRA, so there's lots of opportunities out there.
Yeah, we haven't spoken much about the corporate opportunities, but I know, Azrin, you've spent quite a while working on corporate opportunities for your osteopathic students to go in and see what that experience would be for them and whether that's something they'd like to look at in the future.
Correct. I mean, there's, the corporate companies are now starting to heavily invest and look at opportunities for health and well-being for their staff members. A number of big companies are introducing well-being programs to ensure that their workers and their employees are healthy and are productive, and it provides a bit of a nice work environment. And there are definitely opportunities for healthcare providers, allied health, to be able to try and experience that, and to be able to try and assist with that.
Perfect. I apologise, we've got so many other questions that are there and I haven't had time to pose them. I hope that's given you some time and some information that you weren't able to gather elsewhere. As you know, we've got the live chat that's still there, so if we haven't been able to answer your questions, please head over there and we'll ensure one of our representatives can help you out. As a parent of a student in Year 12, my eldest child's in Year 12, I know how difficult this decision is. What we need you to do is take care of yourself firstly and foremost as you get through Year 12. We know it's difficult, and you know what? Follow your passion. If it's a career in allied health, I can guarantee you, myself, my staff, RMIT will work with you to ensure you have a great experience. I'd like to thank 3 of my staff members here, Tony, Azrin, Sandra. Thank you so much. It's always a pleasure working with you, and thanks for helping to unpack a little bit more about what allied health professionals are, and you're 3 great examples of that. So thanks everyone for joining us today at RMIT's talk on allied health, and we look forward to seeing you soon. Take care, everyone.
Thanks, Regina. Thanks, everybody.